Hello, Dr. DMAC. This is Ivan Acosta from your PT2 class. We're going to do another 360 around the room. All right, and we're going to set you up for our next exercise. So our next exercise is going to be the bent over row. So the bent over row is primarily a strength exercise, especially for the lat latissimus dorsi, with some anti-rotational components going on with it. So for this exercise, I'm targeting primarily the lat for sure as we're pulling. So I want to use this chair as kind of my platform for me to put weight on, and I'm going to be using the dumbbells to simulate the pull. So for this exercise, before we even pick it up, what we want to do is we want to go up to it. We want to put one hand on the platform, and we want to come back into a very powerful stance with the leg with the same side ipsilateral leg that's going to be pulling the kettlebell. It's going to be slightly back from, or slightly posterior from this other leg. We want to kind of external cue that we can give to our patients is push your back pockets towards the wall behind you. So making that hinge as you're doing it. And the other hand's going to come on top, going to be pushing the platform through the floor. That's another cue we can give our patients. So as we grab our weight, we're going to be rowing, simulating a pulling that 6-shooter to the holster. So straight back, going straight into the holster. We don't want to see them coming up to their shoulder. That's a fault we don't want to see. We also don't want to see them hunched over like this to pull. Too much rotation to pull. We also don't want to see them too close and too upright. So these are some examples of things we don't want to see our patient doing. So for this exercise, since it is a strength exercise, we'd be using the rule of 15 to 25 reps. And again, this is an exercise we can do bilaterally. So this is an exercise primarily for patients who have that low back issues and trying to strengthen their pulling muscles and action while not putting too much overload on their lower back.